In 2026, radiology supervision faces its biggest change in decades. This is a direct response to a massive problem: a projected shortfall of up to 35,600 physicians by 2034. The answer is permanent virtual supervision, a CMS policy shift designed to maintain patient access during a staffing crisis. The operational impact is huge. Some facilities report cost reductions up to 30% with remote supervision. We will break down the new CMS rules, the operational benefits, the safety protocols, and how your facility can prepare. The date for your calendar is January 1st, 2026. This is when CMS makes virtual direct supervision a permanent part of the Medicare program. This is not temporary. CMS is officially amending Federal Regulation 42 CFR 410.32 by removing the sunset date on this policy. And this change is not isolated. States are also aligning, with laws like California's AB 460 adopting these new Medicare standards for 2026. So the legal framework is set. But what does virtual direct supervision demand in practice? What are the absolute requirements? The standard is specific: real-time, two-way audio and video. The supervising physician must be immediately available through this connection. These systems must also be secure and HIPAA compliant. Patient privacy is a non-negotiable component of this new operational model. This technology is the core of the solution to the staffing crisis. It allows one radiologist to oversee multiple imaging sites at once. This new flexibility provides a direct boost to efficiency. Facilities using this model are reporting major operational improvements. But efficiency is meaningless without safety. Can a remote physician truly manage an urgent event like a severe contrast reaction? The data is clear and conclusive. A major survey found 0 negative patient impacts from virtual contrast supervision. In some cases, it's actually faster. Nearly 1/3 of centers reported quicker radiologist response times than on-site models. This is not improvised. The American College of Radiology provides detailed specifications for training, documentation, and emergency procedures. With remote coverage, imaging centers can now extend their hours into evenings and weekends without an on-site radiologist. This is especially beneficial for underserved communities. Rural facilities can now offer advanced imaging with expert oversight. We asked if this was safe. This proven record of safety and expanded patient access is why CMS feels confident making this a permanent rule. To support this transition, CMS is also raising the conversion factor for provider payments in 2026 by over 3% for many practitioners. We've seen the why and the how. Now let's cover the updated clinical consensus on contrast media that all staff must know for 2026. This is about more than supervision. It's about a higher standard of care. A new 2025 ACR ECOB-AI consensus updates guidance on contrast reactions. For patients with a history of mild reactions, the new guidance is direct. The first step is to change the contrast agent, not routine pre-medication. For severe past reactions, the recommendation is different. First, consider alternative studies. Pre-medication is advised only if contrast is required, and the consensus dispels a common myth. Seafood or iodine allergies do not increase the risk of a reaction to iodinated contrast media. Be aware, this rule is not universal. Virtual supervision is not permitted for services with global surgery indicators of 010 or 090. Let's connect these points. The mandate for real-time audio and video is the tool that enables a remote radiologist to guide staff through these new ACR protocols. So the 2026 change isn't just about the staffing shortage. It's using technology to apply a higher, evidence-based standard of care everywhere. This means your updated supervision protocols must be complete. They need to integrate technology, communication, and the new ACR emergency workflows. The path forward is clear, and the benefits are proven. So, what are the immediate steps your practice needs to take before 2026? To recap, radiology faces a growing physician shortage that threatens patient care and access across the country. Permanent virtual supervision, beginning in 2026, offers a proven, safe, and cost-effective answer to this challenge. This shift is paired with a new clinical consensus on contrast media, ensuring best practices are implemented system-wide. The time to prepare is now. Start evaluating your technology. updating your clinical protocols, and training your team for this new era in radiology.